Hello, I'm Dr. Archna Sarda from Aurangabad. I'm a diabetologist and founder of an NGO called UDAN. NGO UDAN is dedicated to children with diabetes. Today we are going to speak on hypertension and lifestyle. Lifestyle as a cause and also as an effective treatment of hypertension. Today our lifestyles is totally changing with the changing world. Sometimes there's no space, there's no time, there's so much of stress, so much of work, and we really don't know what to do, how to get a system into place. All these things that happen to us has impact in various diseases which we together call as lifestyle disorders. This can be obesity, hypertension, diabetes, cardiovascular diseases, even behavioral changes like depression. And we are seeing them at such a young age, even in children. So one of the diseases that we see in lifestyle disorders is hypertension. Hypertension is something we don't really take seriously. Often people think of it as just something which you walk in and you get a BP cuff, and if it is high, you pop a pill and it's done. People often forget to check for months or years altogether. They think taking a pill is okay. And sometimes it is just taking a pill also is not okay, and often they omit their medicine for such a long time. But there's something about hypertension that we must know. It is a good thing as well as a bad thing. The bad thing about hypertension, it is not as simple as it looks. It can actually give rise to damaging the eyes, the heart, the lungs, and the kidneys, which can be irreversible damage and leave a person crippled for life. But the good thing is that it is actually preventable, or at least one can postpone its severity and to some extent even reversible by a good lifestyle care. The other good thing is that at least the complications with treatment and with time can be prevented if lifestyle changes are in place. So today we are going to explore what are these lifestyle changes which can actually prevent or postpone or reverse or even prevent the complications of hypertension if we have it already. Today we are going to talk about lifestyle and hypertension, how lifestyle can actually prevent as well as be a treatment and cause of hypertension. When we think of lifestyle, there are so many things that come to our mind. Not having time to exercise, not having enough space, so much of stress, so much of competition, lack of sleep, all these things in our lifestyle are changing and getting probably worse with time to time because of the current environment. All this is leading to a multiple factorial diseases which together we call as lifestyle disorders. One of the lifestyle disorder is hypertension. Hypertension sounds very simple to people. They often just think of it as measuring the BP cuff and saying that, okay, I can just pop a pill and that's fine. People even forget to monitor it later, sometimes omitting their medicine altogether till something serious happens. But I think it's time we talk about it. Hypertension has two good and two bad aspects to it. The bad aspect is that it can be really, really very severe. But the good news is that you can actually prevent the diabetes or hypertension like diseases. Secondly, you can postpone all the complications, you can prevent the complications with a good lifestyle management. And also what is good about this is that today there are so many studies that actually talk about reversing hypertension with good lifestyle care. Do you think you have a healthy lifestyle? We often do, but I think it's time to take a checklist. Let us see whether on the parameters as given by a doctor, are we really healthy? How many calories do we actually need? How many do we burn? And how many do we actually eat? So I really want to emphasize today that it's very important to measure what we do. So many people will tell us we don't eat a lot. But when you actually measure the calories, because it's not just the quantum, but also the quality of food, they end up having a large amount of calories and not burning even half of them. The other thing which is very important is the salty food, especially the processed foods and the packaged food. In today's time, we do not have time to cook. And anything you want, everything is in a small packet, 10 rupees packet, 20 rupees packet. Most of us will just be actually going to a gym or walking deliberately. Our day-to-day life no longer has activity. Do you know that sitting is the new smoking? So sitting more than half an hour without moving your limbs can actually make you prone for a heart attack, can make you prone for a stroke, for diabetes, for hypertension. Even simple activities like moving your limbs, stretching your legs, just walk around in half an hour every time can prevent this. So sedentary lifestyle is something which is a big risk for all lifestyle disorders. A risk we all know. Another lifestyle importance is that alcohol. I know it's a time of social drinking, alcohol for pleasure, etc. But more than a drink a day can definitely be bad for our arteries, for our heart, and lead to hypertension as well as diabetes and all other lifestyle disorders. Sleeping pattern. Not sleeping well is one of a very important risk factors for hypertension and for all other chronic diseases. Last and not least is stress. I don't think any one of us will be truthful if we say that we are not stressed out. We could be stressed out at work, we could be stressed out at home. Do we eat too much? Do we eat a lot of processed foods? Are we very sedentary in our lifestyle? Are we smoking? Are we chewing tobacco? Are we taking more than a drink a day? Are we having a very poor sleep pattern? And are we really stressed out? So if any of these is not okay, I think it's time to take that check mechanism, find a path, and go ahead and do something about it. Do you want to improve your lifestyle? I'm sure you do. Let's look at these things. It's easier said than done, of course. The moment the word diet comes in, it is about eating healthy, eating well, and eating moderately, suitable to your own health needs. Let us talk about exercise. It's natural. It is part of our life. If we do not walk 8 to 10,000 steps in a day, how will our blood circulate? How will our heart pump? How will our skin glow? The bottom line is that lifestyle is your personal choice. It is your need, your pace. Set a goal. Decide how slowly or how fast you would like to go. My appeal is that consult a specialist. Help them to set your goals. Hello, today our topic is smoking. Smoking as a risk factor for high blood pressure. Smoking can actually be a cause for giving us high blood pressure. Surprised? But it is true. It is actually the nicotine in the smoke which is the culprit. The nicotine can make the blood vessels very hard. That can make them narrow and it can make the heart beat faster. All of this, across the world, there are more than 6 million people dying because of smoking. And do you know that 80% are actually into tobacco, but 20% are just passive smokers. It is somebody else's smoking, and 20% are dying as passive exposure to smoke. And 35% of Indian population actually uses tobacco in some form or the other. In India, of course, we have a lot of smokeless tobacco use, but that is equally bad. Often we have patients saying, "Oh, I don't smoke, I just chew tobacco." It makes no difference. Tobacco is tobacco, and it is a cause for high blood pressure. The other reason it is still very important to reduce the smoking and ultimately stop is because the medicines, they actually have an interaction with the tobacco. So when we are on antihypertensive medicines and we also are smoking, it is a biochemical interaction which does not let the medicines work as it should be. As a result, we do not get optimum results, we do not get prevention of complications, and we need a higher dose. So whether it is preventing a heart attack or stroke or lowering our dose, anyhow, for so many benefits, it's very important to stop smoking totally. It is not a one-point thing, which is not so simple to do, but it is something that you can take as a guideline to follow. We call it the START principle, S-T-A-R-T. By S, we want to say set a date. It's not something too far, gives you time for mental preparation, but also is not so far away, so maybe a week away. And that is the date that you start with your venture of stopping to smoke. With T, from the start, we are saying S. Now with T, we are saying tell a friend. Tell everyone who is around you. Tell your wife because you're going to be cranky, or tell your spouse because you're going to shout at them. Tell everyone at workplace. Tell all your friends. These will become your support groups. If they all smoke, if they all have tobacco, you can tell them that let's not do it in front of me because I'm trying to quit. That is a great way to get support and enhance our own efforts. With A, we are going to look at anticipating the challenges. We know what happens to us when we stop smoking. There is withdrawal, there's mental, physical, all symptoms. So anticipate it. You might want to chew something. You might want a sugarless gum or something to be keeping in your mouth that will make you feel comfortable. You could think of having a medicine. R is remove all objects, all cigarettes, all tobacco, all lighters. Every smoke, you can even wash out your room, you can wash your car, because even the smoke smell is going to stimulate you to want to smoke again. So just dry clean everything. That with T, talk to your doctor. There are a lot of ways with medicines or without medicines. Somebody you can call, somebody who can guide you, will be definitely able to help you to combat in your endeavor to try to stop smoking. So with this start stick, all the people I have, all my patients who come back and say that, ma'am, we have stopped, because the slip can happen anytime. Once you have stopped for 3 months, which is the period, most people slip. So if in 3 months you have not smoked at all, it is unlikely that you will do so later. And the feel-good factor is great. The energy levels are great. The blood reports, the blood pressure comes out great. And I'm sure your spouse gets happier. Your children are living in a smokeless environment. So let's, friends, come together and decide today that we are going to say no to tobacco. Not only for our own selves. Tobacco is a major cause of hypertension and, as a result, cardiac diseases.